and welcome to this introductory presentation about MO1026, Drug and Alcohol Services. This module supports skill and knowledge development of the rural generalist in designing and developing assessments and interventions for consumers with alcohol and other drug use issues and their significant others. You will gain an overview of theories and models that have formed current thinking on alcohol and other drug use in Australia before considering the use, harm, treatment and challenges and benefits of alcohol and other drugs in the rural and remote context. You'll extend your knowledge of substances, interventions to reduce harm, screen and assess, and intensive intervention with a focus on psychosocial interventions. Primary concepts relating to health behaviour change are also considered in meeting the challenges of working with consumers with alcohol and other drug use issues in this environment. The intended learning outcome for this module is that you'll be able to design and develop evidence-based assessments and interventions to support consumers and their families who are experiencing alcohol and other drug issues in rural and/or remote contexts. The module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, conceptualising alcohol and other drugs, you'll explore theories and models that have informed current thinking on alcohol and other drugs in Australia before gaining an overview of alcohol and other drug use in the rural and remote context. In week 2, learning about and extending your knowledge of substances, you will test your knowledge of different types of substances before refreshing or extending your knowledge of these. Finally, you'll further research your chosen consumer's primary substance of concern. In week 3, Introduction to Treatment and Interventions to Reduce Harm, you'll consider treatment, services and settings before exploring principles of working with those who use substances. You'll learn about interventions to reduce harm, including working with significant others and psychoeducation. In week 4, Health Behaviour Change, you will gain insight into the core elements of behaviour change. You'll look at matching interventions to stages of change and undertake a motivational interviewing self-assessment to identify what aspects of motivational interviewing you'll need to improve your skills in. Finally, you'll undertake some self-directed learning in your identified motivational interviewing field before reviewing popular brief intervention models. In week 5, Interventions to Screen and Assess and Intensive Interventions, you will learn about both informal and formal components of assessment in the AOD context. You'll familiarise yourself with physical and mental conditions that commonly occur with substance use before finally gaining an overview of intensive interventions. In week 6, Other Treatment Planning Considerations, you will investigate factors that can facilitate effective referral before mapping potential referral pathways for your chosen consumer. You will then refresh your understanding of relevant mental health acts before completing and reflecting upon your psychoeducation session. A single assessment task is due at the end of the module in week 6. This task is a portfolio which will include an audio recording of and reflective critique on a psychoeducation session conducted with a chosen consumer. You will also have the opportunity to submit a formative piece of work at the end of week 2. This is your module workbook, which is not marked but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns and enjoy the module.